Good afternoon, everybody. Let's continue with our discussions. And earlier on, what is a real theme of AHIN is really coming together as peers and sharing with each other what we can do together. And central to that really is us understanding what we're doing in a way. And very, very important is how the rest of our friends, our colleagues at work, and even in sectors beyond healthcare should be able to how we engage them, and therefore building a health ICT workforce. This is something that needs to be discussed in greater detail, and we have invited also a friend to AHIN. So a lot of the advocacies of AHIN around the gaps, as you are seeing here, is also recently being supported by the Fondation Pierre Fabre. I hope I said that correctly. So, ladies and gentlemen, please welcome the Director of Programs, Ms. Solenne Barbe. Okay. Okay, a round of applause, please. Yes.
Thank you very much. Good afternoon, everyone. And thank you for giving me the great opportunity to present the Fondation Pierre Fabre here. So I will show you briefly what the Fondation Pierre Fabre is doing in the sector of e-health. So the Pierre Fabre Foundation is a very unique model in France. We are a shareholder committed to public interest and operating directly on the ground. We were created in 1919, recognized as a being of a public utility. Our mission is enable communities from less advantaged emerging countries to access quality care and essential medicines. We are a shareholding foundation, meaning that we hold 86% of the shares of the Pierre Fabre Group. The foundation does not manage the company and is solely devoted to its charitable public interest mission. So today we are currently running 35 programs in 21 countries in Africa, Southeast Asia, Lebanon, and Haiti, and we are directly supporting local partners in coordination with authorities. So now we are 34 staff at headquarters and in countries offices. In 2022, our overall budget is about 12 million euro, and 25% of this budget is coming from the French Development Agency. So here it's an overview of where we are working. You can see that we have a large of our programs run in Western and Central Africa, but also in Haiti and Lebanon and in Eastern of Asia with Laos, Cambodia, and Vietnam. And you will see that we have some others partnership. So we are working through 5 areas of interventions. As I said, 35 programs in 21 countries, and we are focusing on training of drug specialists, combating sickle cell disease, healthcare access for vulnerable populations, e-health, and dermatology. So today, of course, I will focus on the e-health and workforce. So I may to borrow the phrase from Derek Monini, who gave us the great pleasure to come at our ODS conference this year in late July, where our friend Jai was here, of course. And he said that as we strive for universal health coverage, leaving no one behind, let's make sure that we leave no one offline. So what is behind this health ICT workforce is that we need health workforce that is competent at using ICT tools and application to improve the delivery of health services. Implies digital literacy, capacity of using communication tools and e-learning platforms, being able to collect, use, process, and share information, help implement new technologies, tools, and applications to improve health services and health management. And finally, designing e-health solutions matching countries' health priorities and environment standards and interoperability. So it's approximately what we said this morning. So the main challenges and gaps are common. So building common knowledge shared between health professionals, officials, and private sectors. Strengthen local expertise, establishing digital health system and policies. So our approach is rely on our expertises and we are working through two channels: training and capitalizing and sharing knowledge. So we are training the decision makers, healthcare workforce, and I will go through these three operations that we perform on the field after. And for the capitalizing and sharing knowledge, we built a network of experts and stakeholders, and we have our ODES, which is our observatory of and this center of resource for all the initiatives that we see in our country. So program focusing on training in e-health, we developed the inter-university diploma called Innovation and Health Practices. The goal is to train tech and health professionals and decision makers from MOH to develop adapted and sustainable innovation using ICT. So we are working in an e-health degree with 3 African universities in Bamako, Mali, Dakar, Senegal, and Abidjan, Ivory Coast. We are targeting senior officials as well as health professionals in order to focus on diversity, peer education, building partnerships. And the FPF, the Fondation Pierre Fabre, is providing grants for this. So it's a blended approach with the distance learning about 100 hours plus with an in-person practical work called hackathon to design a collaborative e-health project in Bamako. So finally, we create our digital Santé Mali to foster innovation. We have 59 graduates over 3 years issued from 14 countries, and the 4th edition is ongoing. We are trying to scaling up it in 2023, particularly in Togo, in Lomé, with the hope to perform the double of number of students. So we are trying to acculturate the health professionals, senior officials, and industrialists to promote a consistent, harmonized, and effective transformation of practices. So today we are providing grants and scholarship. So we work a lot with Maidol University when we are targeting, especially in people coming from Cambodia, Laos, PDR, Myanmar, and Vietnam. And we are currently 2 students for the promotion for 2020 and 2022. And we are also giving support to some laureates, some other projects are here in the room. So support focused on research and evaluation. This year we supported 5 projects, including 1 thesis and 2 master science run in Togo and Burundi. We are supporting MOH in Asia and Africa. So today our greatest program in this field is in Togo, and we are supporting them in order to create a national digital health center, including the development of a national digital health strategy aimed at providing a sustainable framework for its digital health action. And we are implementing telemedicine projects. So tele-expertise projects in dermatology at national wide level and tele-ultrasound starting in late 2022. And we are prospecting with the Lao PDR MOH, and we are focusing on capacity building of officials from the digital health team. We are also using e-learning for healthcare. So as I presented you, we have a great portfolio focused on the sickle cell disease. So we are using ICT to train healthcare professionals taking care of patients living with sickle cell disease to the last mile, because today this pathology is undertaken in the country of Africa, and the healthcare are not trained at the university level to cure this pathology. So we developed this platform, and you can access to the course with low-tech tools. And today, this is several hours of courses available only in French for the moment. So until now, we have almost 400 learners from 34 countries registered in June 2022. We're also using ICT in our training programs, so through our Mekong Pharma network, in order to continue education for teachers, staff from partners, university and faculties. And we deploy Moodle to foster collaborative research work and remote learning, especially during the COVID-19 pandemics. And we are prospecting for another project called WeCam. The aim is to create a network for several pharmacy among the continent and connect pharmacy faculties in Africa with video conference. In program ICT2's training, we are performing teledermatology programs. So we are based on our three-pillar intervention. First is to train for a task shifting approach, meaning that the healthcare professional in the remote area are trained to diagnose and treat common skin conditions. Second, the ICT and remote support for a task sharing approach, meaning that implementation of a platform allowing first-line health workers to get remote advices, expertise from a local dermatologist for complex clinical cases and disease. And three, we are trying to evaluate in order to scale up the projects. So now we are running the teledermatology programs in 4 countries, in Mali, Togo, Mauritania, and Niger. And it's up to 383 health workers that are trained in more than 163 health centers. And until now, it's about 8,800 cases sent for a remote expertise. So these projects help meeting the digital literacy needs of healthcare workers. So finally, our last pillar is the capitalizing and sharing knowledge through our ODS. So ODS mission is to identify, analyze, share, and encourage digital innovation in a fragmented ecosystem through 3 components, which are our ODS conference. It's order to learn and compare the perspective of institutions, academics, public and private sectors, and field actors from the South and the North. Until now, we run 6 conferences from hybrid format with live streaming and replay. And over the last edition, we reach more than 10,000 participants in remotely and in person. Yes, we have the chance to be reached by more than almost 20 digital campuses. The ODS is a resource center. It's providing an online resource center available in French and English to document various topics based on the needs of the field, thanks to the expertise of our networks. And finally, we are delivering the ODS laureates. It's a little award who can help technically or financially some initiative that we can prepare. So thank you very much for your attention, and of course you can join and see our website and your and our activity. Thank you.
I think there are a few questions, and I encourage everybody else. And you can see the breadth of work of the Fondation. Maybe, especially our country representatives here, we can also perhaps tie up with the Fondation for other in their areas of advocacy.
Solenne, thank you for your presentation. I see that there's a focus on the pharmaceutical capability building, getting the pharmacists to get training and education on good practices, perhaps. So I was thinking, there's a focus, at least in Asia. I saw that you're also in Africa, but since we're in Asia, that you have Laos, Vietnam, and Cambodia. Do you also engage the other countries aside from Laos, Cambodia, and Vietnam, or is there really a focus on these 3 countries?
Not for the moment, because historically, the Fondation Pierre Fabre is present in Laos, Cambodia, and Vietnam since almost 20 years now. But of course, it's one of the reasons that I'm here today and in 3 days in Laos is that we would like to see how we can expand our presence in Asia.
Thank you. So Laos, Vietnam, and Cambodia are really active members of AHIN. So we appreciate the support that you're giving to these countries. I think with Dr. Bunchay, his project is the Thai medicine terminology. I'm sure you're familiar with that. And we're setting up interoperability labs in the different countries in AHIN. And one of them would be to put up a terminology server that will be shared across different countries. So one proposal I'd like to give to Dr. Bunchay is if we can put the Thai medicine terminology as one of the content of the terminology service, and then maybe because it's a pharmaceutical type of content, find out if Laos, Vietnam, and Cambodia would have find use or benefit from the TMT. Thank you, Solenne.
Thank you.
Oh, if you actually go into the website, it's always mentioned that it is for southern countries on your website. So could you just elaborate on that?
Sorry, what you mean only
on,
South?
on your
Because the others.
Probably she's referring to the global south.
Yes.
so you don't go beyond.
You mean outside the South? No, not. It's we allow exceptionally grants for Ukraine regarding the emergency, but it was very not the case for the other program. We are just focusing on the South. Yeah, because just I mentioned the North for others, because of course the idea is to share the knowledges, and we would prefer to involve everyone in this opportunity, but our programs and grants and scholarships are only focusing for the South.
Just one remark that regarding the IUD, especially that could be of consideration that inter-university diploma course on e-health is something that may be of interest to other countries in the region. So any status update or how it is done in Africa, the 3 universities, that if that could be shared with a wider network, maybe we could, that will be really beneficial probably for the AHIN members.
Absolutely, with a great pleasure. And we know that the format of the training called Interuniversitary Diploma, it's a really French model. But of course, we're keen to find a way to spread this model because we have a great result until now with this.
Because a couple of countries, I think including Nepal and then Lao PDR, they have given the request for the pre-services as well as the post-services like training for e-health. So it will be very helpful for them to know how the model is working, because I understand that it has a lot of practical aspects, not just the classroom education alone. So it will be very helpful to have those inputs. Thank you. Over to you, Dr. Bunchai.
I would like to thank the Pierre Fabre Foundation. We work since we met in, I think, 2018, and we work together to strengthening our digital health or e-health community in Asia. This is my, I would like to request that you expand more, not just the Laos, Cambodia, and Vietnam and Myanmar, but more on the lower middle income countries in Asia, because of in our network we have more than that, and then like we can work with Maldives, Nepal, Sri Lanka, Indonesia. So this is just to get to the foundation that to be more have more footprint in this region would be very good for us also. Thank you.
Thank you. It's absolutely noted.
Solenne and Fondation Pierre.